Good morning everyone. Today we're going to be providing a presentation on the antifungal medications terbinafine and amorolfine used in combination therapy for the treatment of onychomycosis. All information provided has primarily been sourced from the Australian Medicines Handbook online. Terbinafine in this instance is an enteric antifungal, however it is available as a topical agent also. The common brand name for terbinafine is Lamisil. The mode of action of terbinafine is inhibition of fungal ergosterol synthesis through inhibition of squalene epoxidase, which leads to membrane disruption and cell death. For this reason, terbinafine is considered fungicidal. Terbinafine is indicated for treatment of onychomycosis as well as skin infections caused by dermatophytes such as interdigital tinea pedis. Common drug interactions to be aware of as a prescribing podiatric clinician include warfarin, azole antifungals, all drugs acting on liver enzymes or liver function directly, and all drugs removed via liver enzyme activity. Common side effects to be aware of include nausea, vomiting, diarrhea, abdominal pain, rashes and itching, and an increased liver enzyme count, amongst other abnormalities. Amorolfine is a topical antifungal often sold under the brand name Loceral. Amorolfine acts by interfering with the synthesis of sterols or steroid alcohols, which are essential for the function of the fungal cell membrane. Like terbinafine, amorolfine is also indicated for onychomycosis. There are no notable drug interactions for amorolfine in a podiatric setting, and common side effects include erythema, itching and burning, with hypersensitive reactions much less common.
Contraindications. Amorolfine is not affected if the nail matrix is penetrated. In terms of terbinafine, it should be not used if the patient is affected with lupus, as this may exacerbate terbinafine, and it's also not suitable for patients with severe or chronic active liver disease. In terms of practice notes, amorolfine is used for distal or superficial onychomycosis. It's not effective when the nail matrix is involved. It penetrates the nail and remains there for several weeks. Before the first application, thoroughly file down, then clean and degrease the affected areas of the nail using the cleaning pad provided. Apply the lacquer to the entire surface of the affected nail and allow to dry. Before repeat application, file affected nails as required and clean to remove any remaining lacquer. If working with organic solvents, wear impermeable gloves to protect the lacquer or reapply afterwards. Do not use cosmetic lacquers, artificial nails, or occlusive dressings during the treatment. For terbinafine, it's the treatment of choice for dermatophyte onychomycosis. May be used for other forms of tinea where glysulfan is ineffective, treatment of 4 to 6 weeks. It's important to obtain a liver function test at baseline and monitor these and blood count if treating for more than 6 weeks. Stop treating if hepatotoxicity occurs or a rash worsens. Fewer drug interactions than azole antifungals. The average cost for 5 ml of 5% application of amorolfine is $6.40. And for terbinafine, for 42 pack of 250 milligram tablets, it's $35.92.
Hey mate, how you going?
Good, so
Welcome to Richmond Private Podiatry. Take a seat. I'm Mr. Stephen Dank. Aren't you Tom Lynch, the 199 centimetre, 90 kilo full forward from the Gold Coast Suns?
yeah,
The same Tom Lynch who captained Gold Coast this year and was this All-Australian in 2016. Is also linked to a possible trade to the 2018 Premiership winners in the Richmond Tigers.
yeah, you've got me. I just signed a multi-million 6-year contract this morning. Thought I'd come down and celebrate by visiting my local podiatrist before going shouting Rancy and cotching a beer for taking pay cuts to get me in.
Yeah, nice. Fair enough too. I've heard Rance is more of a pina colada guy though. So what brings you here today, Tom?
So Steve, I'm just having some issues with my toenails. They're really crumbly and quite thick and have a gross colour to them. They've caused me quite a bit of discomfort during the 2018 home and away season. And they make wearing footy boots quite painful as well. To add to this, I'm also really self-conscious about how they look, and I didn't even share after the weight session yesterday with the boys because I didn't want them to see them.
Yeah, it's no good, mate. Alright, well I'll get you to take your shoes off. We'll take some medical history, and have a look at these nails. So do you have a history of smoking or anything like that?
Nah, Steve.
Do you have a history of diabetes, hypertension or cardiovascular conditions?
No. just hardball gets.
Are there any other medical conditions that I should be aware of?
No.
So are you taking any kinds of medications?
Just fish oil, magnesium, and some iron tablets, which I take daily. I'm also taking some fitness supplements. They're just creatine and a whey protein isolate. I take both of them daily as well.
Yep. And they were recommended by your GP?
The vitamins were recommended by my GP and the club doctors, and the fitness supplements were recommended by the club doctors and nutritionists.
And aside from your toenails, you're not experiencing any other issues with your feet at all?
No, apart from my toenails, my feet are fine. I did have a minor PCL surgery during the second half of the season this year, but
Yeah, and how's the rehab going for that?
yeah, good. It was all successful, and I've worked up my training intensity to about 80%, and in closed doors meetings with the Richmond doctor, he seems to think it's all going along fine.
Well, I hope so, mate, because they've just signed you for 6 years. So, yeah, okay. So I see what you mean. The nails do appear extremely thick and dystrophic. It appears that the skin around the nail seems to be quite sore and sensitive as well. Is that right, Tom?
Yeah, hit the nail on the head.
Now I see that all of your nails are affected. I'm just going to inspect the whole foot, Tom. There doesn't seem to be any other issues jumping out at me on initial inspection. Your pulses are palpable. There doesn't seem to be any other foot deformities. There doesn't seem to be any breakdowns of skin or infection. It just seems that the nails need fixing. Now looking at your nails, I think that you would have a fungal nail infection of some kind, and it appears that it's affecting all 10 toenails. How long has this been with you for, Tom?
I've had them this bad probably for about 10 years now, Stephen.
And you haven't seen anyone before me? But...
No, I've only just thought about getting them looked at now. I really want to take my game to the next level, and moving to Melbourne, I feel like I've got a point to prove.
So you haven't tried any other treatments at all?
No, I haven't tried any treatment.
Okay. So to confirm my suspicion of onychomycosis, I'm going to take a sample of some of the infected toenails away from it for examination. For this, I'll use an isopropyl wipe to clean the nails, and then take samples of nail clippings as well as subungual debris to send away for microscopic analysis. This is necessary to rule out any differential diagnosis that might have a similar clinical appearance to fungal nail infection. Analysis can take up to 3 weeks, but for a soon-to-be tiger, I think we can get the preliminary results to confirm fungal in 3 days. So how does that sound for you, Tommy?
Oh, you're an absolute ripper. Love your work.
3 days later.
Hey, Tommy.
Good to see
How
you
you going, mate?
Yeah, very
Great
well.
to see you.
Thank you.
Got some news for you here today. Just regarding the samples that we took a couple of days ago. It appears that it has been confirmed that it is a fungal nail infection. And given the severity of your condition, we need to possibly use a systemic antifungal drug to yield any results, as opposed to just a topical on its own. So various studies have found that oral terbinafine produces therapeutic results in over 70% of patients who use it. Although adverse reactions are reported in around 10% of cases, common side effects can include gastrointestinal issues, rashes, renal and hepatic issues due to the increased strain placed on the liver and excretory system. So how are your feelings towards the treatment plan so far?
Yeah, look, Stephen, these nails have been irritating me for as long as I can remember, so I'm prepared to take any treatment and risk the associated risks with them.
Very good. So first we're going to have to refer you to the club doctor to get a liver transaminase levels checked. It's also important for your doctor to be well informed of this treatment, as the drug can have negative interactions with other drugs that can easily be avoided. I'll contact your club doctor and have a conversation about your treatment plan and what tests are required, as well as keeping you in the loop, just once again try and avoid any contraindications that can be avoided.
Yeah, of course. Sounds good to me. I'll word up Bruce Reed and have him see me first thing in the morning, Stephen.
1 week later.
Hey, how you doing,
How are
Stephen?
you today, mate?
Yeah, very well. Very keen for the big dance. Keen to get these nails looking schmick.
Yeah, beautiful. So I've just received the results from your doctor for your liver function tests, and it seems that everything's within normal limits. So I'm going to prescribe a combination therapy of topical and morphine for 15 months, combined with a 12-week course of oral terbinafine.
Yep.
So what this means is you'll have to apply an antifungal nail lacquer once a week for the full duration of the treatment plan. The terbinafine will be a 250mg tablet taken once a day for 12 weeks. It is also important that you monitor yourself closely and watch for symptoms such as gastrointestinal discomfort. Once again, I've already mentioned rashes. And if you have any problems or queries, just contact your GP or I, and we'll be happy to rectify the issue. I have a follow-up appointment booked for you in 4 weeks, so if all goes anticipated, I'll see you then, mate.
Very good. Cheers, Steve. You're a bloody lifesaver. And I'll keep a close eye on the rig and make sure I come see you if there's any problems.
Beautiful.
Cheers.
2 weeks later.
Hey, Tom.
Hey, how you doing,
How you
Steve?
going, mate?
Yeah, good, thank you.
Alright, so we had an appointment booked in for late next week, but the assistant said that you've been experiencing some pain, so yeah, what seems to be the problem?
Yeah, so it's been probably about 2 weeks now since I started taking that medication and used the nail liqueur you gave me. And for about 3 days now I've been experiencing some really bad burning and itching around the skin surrounding my nails. Obviously my nails have caused me discomfort before, but this is something new altogether.
Yeah, no worries. Alright, I'll get you to take your shoes off and socks as well. I'm glad you came back to see me. This sensation is not uncommon with topical antifungal creams, so don't be distressed. It's simply your body having a minor allergic reaction to the cream. So you haven't been having any stomach problems or anything like that?
No.
No vomiting, diarrhea or nausea, episodes of unpleasant taste in your mouth?
No, all good.
Very good. I'm just making sure. Now, what we're going to do, Tom, is stop using the topical cream as of today. It's clear that you're having some adverse effects on the skin around your nails, so we'll cease using that because of the pain that it's causing. I do want to continue with the oral terbinafine as prescribed, though. Studies have shown that combination therapy of both topical and oral agents is far more effective, but the terbinafine alone still yields a 70 to 80% success rate in itself. It is this reason I'll keep you on the drug and hope it improves your nails in the future. I'll remind you again that this isn't an overnight fix, and you'll have to wait some time before you see any results in your nails. I've got another appointment booked for 4 weeks to check up how you're getting on, and the oral terbinafine can get quite toxic, and the side effects are quite pronounced after 4 to 5 weeks of use. So I just want to run another liver test as well. I'll get onto your GP and make sure that all that is followed up, as well as some blood work as well, just to ensure that there's no adverse reactions that we might be missing.
Good. Yeah, no, that sounds great to me, Stephen. I understand that this might be a long process, but I've been living with it for 10 years, so I can afford to wait and be patient. And again, thanks for all your help and looking out for me over the last few weeks. And I've already recommended you to Jack Rewalt, who needs a pair of custom foot orthotics. So yeah, thanks again, and I'll see you in 4 weeks.
Very good. Thank you very much, mate.
Cheers.
Cheers.
Oh, we're from Tigerland, a fighting fury, we're from Tigerland.